Before we begin, this content is for educational purposes only and should not be considered medical advice. Please consult a healthcare professional for personalized recommendations. Welcome back to Homeopathy Clinical Tips. In today's episode, we are diving into a remedy that works wonders in one of the most painful dental conditions, wisdom tooth pain. Let's talk about Belladonna, a remedy with intense heat and suddenness at its core. Picture this: a patient walks in with a swollen face, red and hot to touch. They are clutching their jaw in pain. The toothache came on suddenly, it's throbbing violently, and any movement, even a gentle tap, worsens it. They say the pain shoots to the ear and it's worse at night when they lie down. This is a classic Belladonna picture. In Kent's Materia Medica, Belladonna is described beautifully for such toothaches. Toothache comes on suddenly with pulsating, throbbing pain, worse from motion, especially from jarring contact or pressure, face swollen, hot red, gums are swollen, bleeding, sensation as if teeth were too long, worse at night and on lying down, pain extends to the ear. This matches what we see in acute wisdom tooth inflammation, especially the early phase when the inflammation is intense but no pus formation has yet occurred. Now let's compare Belladonna with some other commonly indicated remedies in wisdom tooth pain. Chamomilla, great for toothache with unbearable pain and irritability. Patient is restless, extremely sensitive to pain and may scream with anger. One cheek is red and the other pale. Worse from warm drinks, unlike Belladonna, which is worse from cold air and touch. Think chamomilla when the mental state is the focus, the pain is exaggerated in the perception and patient is oversensitive. Next is Hepar sulph, useful when the pain has moved into a suppurative stage, that means pus is forming. Toothache is sharp, splinter-like, sensitive to cold air and touch. Patient wraps up warmly and may become irritable and chilly. Better by warm applications. Hepar follows Belladonna well once inflammation becomes localized and pus is about to break through. Merck Sol, when the pain is associated with foul odor, metallic taste and excessive salivation. Gums are spongy, bleed easily and there is often nightly aggravation. Patient feels hot and cold alternately. Merck Sol is more suitable when the infection is deep-seated and progressing, not in the early throbbing stage like Belladonna. Next is Silesia, helps in chronic lingering dental abscesses, especially in patients with poor healing. The toothache is deep with slow pus formation and patient may be chilly, weak and sensitive. Silesia is rarely used in acute Belladonna-like cases but comes in when there is chronicity or poor resistance. For chronicity, we can also think of calcarea carb and mac carb. So here's your clinical tip for the week. In acute, sudden throbbing wisdom tooth pain with red swollen face, heat and radiating pain, Belladonna is your remedy. Use it in the early inflammation stage before pus develops. Compare with chamomilla for irritable patients, Hepar sulph when pus is near, and Merck Sol when fold discharges or suppurative domination. Thanks for tuning into Homeopathy Clinical Tips. Catch us every Thursday at 5 pm for quick practical insights to sharpen your clinical practice. Next week, we'll dive into another powerful remedy for acute conditions. Stay tuned.